evening. My name is Sandra Valtero, and this is Be Prepared's monthly April show. Tonight we are discussing complementary health practices. One of the most important ways we can be prepared is, of course, to stay healthy. There has been an increased interest among the healthcare community in learning about alternative health practices. While Western medicine concentrates on the physical aspects of the body's function, Eastern healing practices focus on maintaining the flow of energy throughout the body. Some practitioners believe that these two approaches can complement each other, and some have even incorporated both into their practices. Tonight we will explore some of these differences while we speak to our guests and look at some interviews we have taken. First of all, I'd like to introduce our guests. Dr. Kandyce Mutter, who is a licensed chiropractor from High Point Chiropractic here in Burlington, Massachusetts. And Dr. Mutter is a graduate of the University of Brunswick, Canada, where she has earned a BS degree in kinesiology and completed the chiropractic education at the Palmer College of Chiropractic. She specializes in corrective spinal therapy called chiropractic biophysics. Okay, welcome.
Thank you.
Also with us is Dr. Eleanor Marks, a Tong Ren healer from the Oriental Cultural Institute of Healing in Haverhill, Mass. Dr. Marks received her master's in education at Harvard University and went on to receive her PhD at the Boston University. She is presently a Tong Ren practitioner since the year 2000. So ladies, welcome.
Thank you.
Thank you for having us.
So let's get started. I want to start off, Kandyce, with what is the definition of chiropractic care? What would you say?
Sure. So chiropractic is a system of healthcare that is based on optimizing health through optimizing the nervous system. As you know, the brain controls and coordinates everything about us. And it does that by sending signals down through the spinal column and out through 31 pairs of nerves. And of course, I brought my spine with me here today to show you. So all of these nerves that you see pictured here, they go to different organs, muscles, and tissues. Now, those organs, muscles, and tissues, they communicate back with the brain through other nerves. And that's how we function as human beings, is through this wonderful circuitry that we have here. Now, as we grow up, when we're young, we have falls. Sometimes we get into car accidents. Sometimes we have sporting injuries or other injuries or issues, and it can create misalignments in our spines. So the chiropractor is trained to analyze and locate areas in the spine that are out of alignment. Now, we call that a subluxation, which literally means partial misalignment. So we go in there and we assess the spine, and then we gently correct these areas of misalignment so that the brain can communicate better with the body.
That's good. Very interesting. Sounds complicated, but it's interesting. Okay, Eleanor, how does Tong Ren therapy work?
Well, it's amazing because it works so well with the theory you just espoused for chiropractic. Tong Ren, we unblock blockages in the nerves. And it's very important to us to also unblock blockages in the arterial blood flow. So all of our healing is premised upon having that bioelectricity flowing freely from the brain through the nerves to the organs and the organ systems, and also supporting them with increased oxygenated blood flow. And that's really Tom's whole practice of medicine, through the collective and moving energy through the collective in a variety of ways.
Okay. Well, since you mentioned Tom Tam, who is the founder of Tong Ren Healing, let's take a look at an interview I had with Tom. Tom is a licensed acupuncturist from the Oriental Cultural Institute of Healing in Haverhill, Massachusetts. He is also the founder of the Tong Ren Healing System. And Tom is a writer, poet, and healer. And he has been practicing acupuncture, Tai Chi, and Qi Gong since 1982. He wrote the Tom Tam Healing System in 1995, and he also wrote a Chinese healing book on Zen and the palpitation diagnosis in 2005, I think it was. And this book combined the West and the East medical knowledge and formed a new theory for the understanding and the healing the difficulties of disease. And you can find Tom in one of his healing centers, either in Quincy or in Haverhill. So let's take a look at that interview I have with him. I'm here at the Oriental Cultural Institute of Healing with Tom Tam.
We are in Haverhill for the healing and training. About 26 years ago, I developed a form of the healing based on the collective unconsciousness. And now we almost every day have the healing class with the Tong Ren.
And what is the Tong Ren treatment?
So we believe the collective unconsciousness, the energy can heal. So each case of the disease must have the blockage. Cancer, ALS, MS, HIV, or any disease, we must know where is the blockage. In my studying, is a focus on the blockage.
And how do you discover where the blockage is on a person?
Basically, the blockage is from the nerve system. We have a true nerve for the heart movement. The heart problem, we found out the blockage on the sympathetic and parasympathetic nerve for healing the heart problem or any internal organ. So when we found the blockage for the disease, then we can use any technique you like. So we just use a hammer and the door of the acupuncture point, breaking down the blockage. We can use the Tui Na, that's a form of the Chinese massage. Shiashu, or I use the Tong Ren knife for the healing. You can use the knife for the healing, move them and move the energy by the knife. Or we can put it on the body to open the blockage also as a massage. How can you put it on the door to heal my problem? Tong Ren uses the collective unconsciousness. On the quantum physics, we call the entanglement. There is no time, no space. So we are not limited. When you do it in here, anywhere, they can receive the energy. In the West, they still do not have that internal organ, the nerve system. But their focus is the chemical. The NIH, they pay to do the study to map the nerve of the heart. Most of the oncologists in Dana-Farber, they know us because we require all of our cancer patients talk to their oncologist. 7-8 years ago, the Dana-Farber come here, do the survey on us. Italy, we already go into the mainstream. They have so many medical doctors and alternative medicine people practice the Tong Ren healing system. I'm 4 times to Italy to train the people in Italy, France, and Belgium, and beginning and the whole Europe, the people coming.
Wow, right. Well, thank you so much, Tom, for letting us talk with
you
you tonight.
will come. Yeah.
All right. Well, so why don't you answer this for us? How long have you been doing the treatment? You said since
2000.
2000, okay. And what do you find about the results of this type of treatment, the Tong Ren treatment?
It's pretty amazing. I came to Tom because I started going blind when I was 24. So after 4 detached retinas and cataracts, I have plastic silicone buckles behind my eyes. No more surgeries were proposed because the risk was too high, partly due to having been prescribed steroids for too many years. So Tom said to me, "Eye doctor, touch your neck," meaning the problem with my eyes was because the facial artery was blocked and had been blocked for a very long time. So I didn't have any other options. And over the course of a year, I got acupuncture in Tui Na, which is a very deep Chinese massage, to open up the neck area and other support points. The detachment, which was almost to the bridge of my nose, completely blind, that vision came back. There were multiple holes in both retinas. They healed. The cataracts went away. So it's very interesting if you look at the process of opening up the nerves, the signals from the brain, the oxygenated blood flow. In Tom's system, just like you said, the brain is sending the signals to heal the body, but it needs to get those signals to the affected organ. So when we work with people, that study that Tom mentioned that was sponsored by Dana-Farber, the success rate for all the cancer people who we interviewed was between 89 and 90%.
Wow.
That's what we see in our practice for most illnesses.
I see. Wow. So what kind of results can we expect from chiropractic here?
Well, it depends on the goals of the patient, of course. You know, in our culture today, the understanding of chiropractic is that it's good for neck pain and back pain. What's interesting is that that's not how chiropractic started. Chiropractic was discovered in 1895, and similarly to your experience, it was discovered by a magnetic healer named D.D. Palmer, and he was working in his office, and a janitor came along who was hard of hearing. And what he noticed in his neck was a misalignment or a bulge, as he was quoted as saying. What he did is he took that bulge and he applied a force to it. After he did that, the janitor grabbed his ear because he heard a loud ringing noise, and it was the first sound that he had ever heard in his life. And so D.D. Palmer postulated that a vertebrae out of alignment can put pressure on the nerve going to the ear. And that's what's interesting is in the neurology of the neck, all of the nerves go to our special senses: ears, eyes, nose, throat. And if there's any sort of obstruction, misalignment, or subluxation, as we call in chiropractic, it can interfere with the flow of energy.
Wow.
Yeah.
Interesting. The both of you almost sound the same. Okay.
Yeah. Yeah.
Okay.
It's very complementary.
Yes, it is.
So tell us about Tui Na massage.
Well, Tom was the first person to bring that to the United States. There are many different forms practiced in China. In Tom's, the focus is on the Tom Tam healing system, which means unblocking the nerves and the arterial blood flow. In China, the emphasis is looking at how the meridians run and unblocking the meridians. But what Tom says, in Western medicine, there's such an excellent map of the nervous system, excellent map of how the arteries flow. So deep pressure is applied, soft tissue, in gradually increasing strength to open and relax the soft tissue and muscles, tendons, and ligaments. And usually we work from the head down the spine for the sympathetic nerves, and we spend a lot of time on the neck and accessing, for example, the vagus and the parasympathetic system that way. And then there's a whole network of support points.
So in doing that, you're releasing the blockages that might be in that person's
That's one of the
body.
ways. Like Tom said in his interview, you can do it with the doll on the hammer, with the knife on the doll, with the knife on the body. Chiropractic, shiatsu, any modality, as long as you release the blockage so that the organ can heal.
Wow. So what kind of equipment do you use in your practice?
So we generally use our hands, and in fact, chiropractic literally translates to with hands. But we have other tools and gadgets we use. Our tables are designed to help us target bigger joints of the body, so when we need to really access certain areas. We also use an instrument that's called an arthrostim, and it's a very small point that applies a gentle impulse into the specific joints. We most often use this with infants, children, adolescents, even senior citizens, those that might have osteoporosis or osteopenia. We take that gentle instrument approach with them just to achieve the results we're looking for.
Now, does this take multiple visits for results?
Well, again, it depends on the patient coming to us. If we see a newborn infant who had a very difficult birth, they might need one or two specific gentle adjustments to, say, for example, help them latch or help them breathe a little better. If it's, say, a typical 40-year-old who's had car accidents and sporting injuries and sits at a desk all day and has done so for 15, 20 years, well, there might be a little more wear and tear in their spine. We always do x-ray examination so that we can assess the health of the spine, and it also gives us the blueprint that we need to know how to treat them appropriately.
Excellent, yep. So, Eleanor, how do you combine the Western knowledge of the anatomy and the physiology with the ancient principles of qi or life force?
That's my favorite part of working with Tom because the way that he brings his cultural knowledge and his genius for healing into the Western setting is this. He's trained in how to move energy, qi, bioelectricity. And as he said in his interview, in Western medical approaches, there's a real emphasis on pharmaceutical and chemical approaches to healing the body. And sometimes that's required. But if the primary issue is a blockage to the nerve or decreased arterial blood flow, the real thing that has to be addressed first is unblocking that nerve signal from the brain, for example. And addressing that with chemicals or pharmaceuticals is probably going to obscure the problem. So Tom puts together this very fluent knowledge of how to move energy. And as he said, it goes through the collective, meaning it's quantum, there's no time, there's no space. And the real idea is if someone comes to us with a Western diagnosis, we always require people to go to medical doctors and get a good diagnosis, then we know from what the specific illness is where the blockage is on the body.
Interesting, yeah. Okay, Kandyce, is your office set up any differently than other chiropractic offices?
Some people have reported to us that it is.
Yeah.
A traditional chiropractic office would have a waiting room and little rooms that you might go into, but we have more of an open concept office, which resembles more like a physical therapist's office. So when you come in, you see our front desk, and then you move over to the seating area where your care starts. We start by warming up the low back. We have people sit on what's called a wobble disc, and it gets them ready for their adjustment. Then they go behind a partition and have the adjustment, and then we give them to our exercise therapist, who brings them in to do different things in the office based on what they need. So it's partially open, but I really love it because it creates a communal atmosphere. Patients can talk to one another. Hey, what are you in here for? What are you in? And share their success stories.
Yeah.
So I really love what we've created in our office.
Yeah, it sounds nice. Yeah. I've seen it, and I think it's nice myself.
Thank
Yeah.
you.
What is the average amount of people who come to Tom Ren's healing sessions?
Well, we need to talk about the healing sessions because that's another way we unblock blockages. We have classes, what used to, in Tom's wild sense of humor, be called guinea pig classes. Now they're called Tong Ren Healing classes. They were originally named that because so many of our patients, especially anyone with stage 4 cancers, they would be automatically put into clinical trials, and it wasn't explained to them how they were being a guinea pig. So we were taking that and kind of liberating it and having a great sense of humor about it because we were treating people in a non-toxic way. So the classes in any of our locations, anywhere from 30 to 100 people will show up for the classes. We call them tapping classes, down to earth. People show up, and people will have 1 or 2 or 3 requests for healing. And based on their requests and our knowledge of what blockages cause those illnesses, as a group, there'll be 1 to 10 to 20 practitioners in the front of the room tapping on the doll with a hammer, going through the blockages, opening up the nerves, opening up the arterial blood flow, sending the chi or the bioelectricity through the doll to the person. And that's the part that's working collectively.
Did you bring a doll with you?
It's
In
in
the other
there,
room.
yeah.
So the doll represents points, acupuncture points,
Yes.
so that when you're tapping on acupuncture points.
Well, we're using acupuncture points as a map to the nerves and the arterial blood flow. We're not so much focusing on the meridians. We're really interested in figuring out metabolism points, immune points, the cardiovascular system, for example. And that's what we work on. So when Tom wants those places unblocked to heal somebody, either in a class or with the doll and hammer, with Tui Na or acupuncture, what we're really doing is moving the bioelectricity through the nerves and increasing the oxygenated blood flow. Every single cancer cell is low voltage and low oxygen. And we know when we change that, cells, the metabolism cleans out abnormal cells and replaces them with healthy new cells. And as a matter of fact, we could apply that to the brain, Alzheimer's, ALS.
Yeah.
So.
Okay. You also do something with orthotics, right?
Oh, yes. So an orthotic is an insert that you put in to your shoe to help support the architecture of your foot. Unfortunately, our feet are really the most neglected part of our body, aren't they?
Yes.
So many people deal with things like bunions or plantar fasciitis, metatarsalgia, all kinds of different foot issues. And the misconception is that a lot of these problems are caused by heels. The reality is it's our arches collapsing. We exist in gravity, so that it's always exerting its force on our bodies. Now, as a chiropractor, it's important for me to make sure that the feet are in good shape because they're the main shock absorbers of the body. It's what you contact the earth with. So if someone comes in with, say, some low back issues, I immediately want to make sure the architecture of the foot is in good shape if I'm going to help them with their low back. But not all orthotics are created the same. A lot of the conventional orthotics that we see nowadays, they have you step on a plate, and they're really getting a two-dimensional image of a three-dimensional object. Okay, they might check the size of your foot, and they maybe check some pressure points. What we do at our office, we have orthotics called sole supports, and we create a three-dimensional cast of your foot, and we send it to a lab, and it custom makes an orthotic for the shape of your foot. Now, it's important to remember that a flat foot, or what we call an overpronated foot, which is very common in our society, needs the right type of pressure. A lot of people complain that their orthotics are painful. It's because they're too hard. You need a lot of flexibility in an orthotic. So we can actually pick the type of plastic that the orthotic is made of. And conversely, for an arch that is very high, it needs a lot of support to keep that arch patent the way it's supposed to be. So it's a really important part of what I do, just to help with the stabilization of the spine.
I was going to say, that does affect the spine, doesn't it?
It can. Not everybody, but we always check the feet out just to make sure that we're covering all our bases.
I know they can be uncomfortable. Years ago, I had one made. It was made out of like a hard leather, and it had no give to it at all, so it was very uncomfortable. So
The science of orthotics has really come a long way, and they realize that they have to have a lot of different components tailored to the individual's needs in order to make a good orthotic.
That's good to know today.
Yeah.
I have to try it again, right? Eleanor, you want to say anything more about Tong Ren Healing? Or?
Well, the thing with Tong Ren Healing that Tom also wants people to realize is anybody can show up at our classes and learn. And we're constantly training people. And there's something pretty powerful about knowing, before the show we were talking about how to prepare for health, how to stay healthy through all the decades of our lives. So when people have something that they can turn to, if they have a headache, if they have a backache, if they have a digestive problem, it works really well with children, for example, and teenagers. You know that you can tap for anyone in your family, friends, animals, anyone in your community, and coming and joining the classes is an incredible participatory experience because everyone's talking about really serious illnesses and the progress that they've made and how they've healed and what they've learned putting it together with Western approaches. So it's very empowering. It builds a lot of confidence.
That's good. What kind of feedback do you get from some of your patients?
Oh, well, they love chiropractic care. I would say over the past, in my career, over 10 years, I've seen an increase in families coming into my office, and I just love it. Especially having two little ones, I love seeing children come in to get their spines checked. And that's what I want people to know about chiropractic is that while it's very good at helping people with things like neck pain and back pain and tingling and headaches and all that stuff, it's more about preventing these issues and keeping your spine in excellent alignment throughout the lifespan. It's so much easier to keep children in good shape as they grow rather than fix these problems. So that's what I like to see, families coming in and including a chiropractor as a part of their healthcare team. I think it's great. I love working with MDs and pediatricians and other healthcare professionals to keep our community healthy.
That's a good idea.
Yeah.
Start them off young, right? Taking care of them. Learning that that's important, I think.
Yes.
Because I don't think our parents in our day ever, stressed how important it was to do those kinds of things. You know? So this is really good. So, any other last comments from you, Eleanor?
Well, I want to thank you for having me here. It's lovely to meet Kandyce. And it's so wonderful to see how your approach physically with the spine to unblocking the nerves and our approach working on the soft tissue, they really go together.
Yeah, definitely.
And the whole thing is to get that healing signal through the body.
Absolutely. Well,
and then what Tom says is we have to send it out to the entire society, right? Heal each individual, heal each family, and heal the society.
And I think, too, I heard that, people can come to you and they don't have to actually believe
No, just
what's
be
happening.
curious.
They can be curious and they can sit down and get the benefits as well from the chi in the room. Right?
Yeah, exactly.
Well, thank you very much for joining us tonight, both of you, while we learned about complementary healing practices. Please join us again this month of April, where we'll do part 2 of complementary healing practices. So good night and stay well, everyone.